approach, but is one of the most important approaches besides the other actions that you are going to do. So if it is from 10 to 12, okay, you have to increase also the frequency of turning. You have to take care of the supplementation as well. So the treatment or the prevention of pressure ulcer, it is a teamwork. You have somebody from nutrition, somebody from quality, the wound care nurse, the ICU nurse. So you have different approach and teamwork to prevent the pressure injury. The another indication which some of you can be seen in the ward on changing the dressings or taking care in the diabetic center, which is the diabetic foot ulcer. We have different types of diabetic foot ulcer, as it is like charcot foot, callous foot, some infected, non-infected, some large size wound, some small size wound. So it's different from one patient to another. So how we can assess the diabetic foot ulcer? We have different approaches from skin assessment, vascular examination, neuropathy, deformity, and footwear. So we took different types of approaches to see how to assess and evaluate the risk or the severity of this diabetic foot ulcer. So now we are talking about our XU advanced dressings in the management of the wound. Okay, if you have wound or you want to prevent the wound, which type of these dressings that you can use with which type of wound? You have here a lot of dressings. How can I manage that? What is the difference between all of them? So we have to first use this classification. Okay, if it is infected or not infected, this is the first type of the classification. If it is infected, we have to use antimicrobial agents, dressings. So if it is infected, either it is diabetic foot, either it is pressure ulcer, either it is leg ulcer. So we see if it is cavity wound, we can use the Lofcon extra silver alginate. Okay, it's made from alginate dressing and with silver ions. We will speak about it later. Okay, so you can pack the cavity wound with it. So if it is infected shallow wound, we use the silicone foam 5 layers of Lofcon silicone foam 5 layers AG, and we will speak about it later. If it is slightly infected, we have another product called SureCell. It is made from gelling fiber with a new technique from modified chitosan, which can be used as an antimicrobial, hemostat, and exudate management. So, if it is red wound in the granulation phase and non-infected, we have two types of dressing. We have, for extremely exudate wound, we have super absorbent dressing, and from moderate to high exudate wound, we have Lofcon silicone foam 5-layer dressing. For the surgical wound, we have, for the unflattened and joint area, we have Lofcon silicone post-op for the joint and unflattened area. For the prevention, we always use the Lofcon silicone foam 5 layers. So this is our map, okay, which type of dressing with which type of wound. At the beginning, again, we have to classify if it is infected or non-infected, as per the color. Infected, is it deep or cavity wound or shallow wound? And if it is not, then which type of dressing? So this is very, very important, and this is the role of our medical representative to work with you closely here to make sure that you are using the right dressings for the right type of wound. So now we are talking about the infected yellow wound, which we can use with it Lofcon silicone foam 5 layers, as you see with me here. Oh. Sorry. Any question?
understanding